Halloween is likely a little scarier for most Canadian families this year as they try to navigate trick-or-treating during a pandemic. Many of you are probably wondering about the risks. The Prime Minister and his family aren't taking any chances.
My family will not be going trick-or-treating this year because in Ottawa and in Ontario, in red zones like Ottawa, they are not encouraging or not recommending trick-or-treating, and therefore we won't be.
In Toronto and Ottawa, people are being asked to celebrate Halloween at home. In Quebec, kids can go out as long as they stay with members of their own household. While in BC, health officials want people to keep their trick-or-treating groups to 6 people or fewer. So how can Halloween be done safely in this year of COVID? Oh, some answers. We're joined by infectious disease specialist Dr. Susie Hoda and Dr. Isaac Bogosh. And let me start with you, Dr. Hoda. In Ontario, as you know, the message in many zones not to go trick-or-treating in those hot spots. What do you make of that advice?
Well, I think first and foremost, we all have to follow what our public health authorities are telling us to do in the region where we live. But that said, I personally don't think that trick-or-treating itself is the riskiest thing that you can do in Halloween. I mean, it's primarily done outdoors, and it's not that hard to actually integrate public health safety measures into your trick-or-treating. What I worry about is by prohibiting trick-or-treating in some hotspots, people might end up having parties instead. And that's where we're seeing a lot of transmission happening. And it's been continuing to drive transmission in hotspots and what we should be avoiding. And
Dr. Bogosh, what would you like to add?
I completely agree with Dr. Hota. I think this can be a low-risk endeavor, but of course we should be adhering to our public health guidelines, and people should just look out to see what the recommendation is for their region and adhere to it. It's as simple as that.
Now, there are many places across the country that are allowing trick-or-treating. Some have local guidelines. Some aren't so clear on what people should do. So let's go to a video question. Dr. Bogosh, I'll direct this to you. Here are Leilani and Kaya Wong in Richmond, British Columbia.
What precautions are good for trick-or-treaters?
All right, Dr. Bogosh, that question. What precautions are good for trick-or-treaters?
That's a great question. I think if you are allowed to go trick-or-treating, there's a few precautions that we should all take. One is to stay outside. We know outdoor environments are much safer than indoor environments. The second is to stick within your family unit. We should be avoiding large crowds, which might need some parental guidance there to make sure kids don't run off and join a large crowd. Masks would also be very, very helpful. And then, of course, we have to adhere to good hand hygiene in addition to that. So it's a good idea to have some alcohol hand sanitizer with us. But those are just simple rules, simple things that we can abide by to make trick-or-treating a lot safer.
All right. Dr. Hoda, here's something you and I spoke about last weekend on Cross Country Checkup. This is in a video question from Lori Checkley in Calgary.
I'm just wondering, as a concerned parent, what is recommended for Halloween night in terms of handling the candy to prevent any transmission with the coronavirus?
Right, so that's also a really excellent question. And I think over time we've learned that surface-based transmission of the virus that causes COVID-19 is lesser of a concern. It's not completely eliminated as a concern, but it's lesser of a concern. So I don't think that there's any need for elaborate disinfection protocols around, candy wrappers or anything like that. But what is really important is that you wash your hands frequently as you're handling the candy. So I'd suggest washing hands, opening the wrapper of a candy bar or whatever it might be, putting it into a bowl, tossing the wrapper, and then washing hands again before you're going to go ahead and eat the candy. Now, if people aren't comfortable with that because they're really in an area where there's more COVID than they'd like to see, you can quarantine the candy for 3 days. Just be prepared to have patience on hand for your children who might not really like that idea.
Yeah, that's the mother in you as opposed to the doctor in you coming out with that last little bit. And so let me get a last comment from each of you. Here we are on the eve of Halloween, and as parents, you know how important that night is to kids, but also as infectious disease doctors, you know how important it is, as you've said, to follow the rules. So, Dr. Hoda, last thoughts on this?
Nothing is free of risk during this pandemic, so it's all about balancing risk. And, I think it can be done safely, so listen to what your public health authorities are saying and enjoy one night of a bit of a release from this reality.
And Dr. Bogosh?
I'm with Dr. Hoda on this one. I think obviously we have to adhere to our public health guidelines. People that are going out trick-or-treating, there's easy ways that you can do this safely. We really just have to avoid close contact in indoor environments. We should really avoid all those indoor settings if at all possible, because that's where we know the virus is most easily transmitted.
And are either of you into dressing up? Is that part of your plan for the weekend?
I am dressed up.
Well,
Some of us don't need it, Ian.
I will be very disappointed if there are not any Dr. Hoda's or Dr. Bogosh's trick-or-treating on this weekend. I'll be on alert since I'm here to see if anybody does fulfill that promise. Thanks to both of you, and I hope you have a great weekend.
You will.
You too.